For those of you that may not be aware, Accessia Health is a nonprofit patient assistance organization. We provide programs and services to individuals living with rare or chronic health conditions. One of those services is case management, and we'll share a little bit more about the program after the presentation today. You can also learn more about Accessia Health by visiting us at accessiahealth.org. Our topic today is Understanding Social Security Benefits, a guide to SSI and SSDI programs. We are so excited to present this topic today because these programs provide critical financial assistance and access to healthcare. I'm Amy Jackson, Case Management Specialist with Accessia Health, and your moderator for today. Before we get started, I would like to go over a few housekeeping items with you. First, all lines will be muted throughout the duration of the webinar, but we welcome you to submit questions using the Q&A feature located on your screen. We hope to have time at the end of the presentation to answer all of your questions. However, any unanswered questions will be answered offline. For the convenience of some of our viewers and for those who are hearing impaired, closed captioning has been enabled. This webinar is being recorded and will be available online in the future at accessiahealth.org. There will be polls administered throughout the presentation, and we encourage you to participate as they pop up on your screen. Accessia Health webinars, events, and conferences are intended to provide information to the public. The views and opinions expressed by any speakers or other third parties are not necessarily those of Accessia Health. And I am so honored to introduce our speaker today. Jackie Weisgarber is a public affairs specialist based in Richmond, Virginia, where she covers Social Security outreach and education throughout Central and Southwest Virginia. In this role, Jackie implements Social Security's communication plan through local, regional, and national outreach, while working closely with the Philadelphia Regional Communications Office and the area's Director's Office. Jackie previously served as a claims specialist for 10 years, based in the Charleston, South Carolina field office, where she implemented Social Security policy, adjudicated over 10,000 claims, managed special projects while serving the public with compassion, courtesy, and respect. Prior to joining Social Security, Jackie was a project manager for a health benefits tech firm and a PR specialist for a national nonprofit. Jackie has a BA in journalism from the University of South Carolina and an MPA from the College of Charleston. Welcome, Jackie.
Thank you so much. And thank you again for the warm welcome. Hi, everyone. I am Jackie with Social Security. It's a pleasure to be here today. Welcome if you're on the West Coast, the East Coast, or somewhere in between. As Amy mentioned, I cover Social Security public affairs. I'm based in the Richmond, Virginia area, and I've been with Social Security for a long time. I have worked directly with the public in a capacity where I completed claims, so I understand what the needs are and how complex this can be for folks navigating the system. You know, our goal today is to share some important resources so that patients, advocates can navigate this process. Learning about what disability is, what the rules, requirements are. I just want to quickly give you kind of an organizational update on Social Security. As an agency, we are an independent federal government agency. We have around 1,200 field offices throughout the country, and that is what people think of when they think of Social Security, where our staff is working directly with the public. We are helping process applications, maybe help someone with the replacement Social Security card, update their name, that sort of thing. And, you know, over time, we've really enhanced our online services, and you're going to hear me plug that a few times throughout this session. And I just want to say right off the bat, if you don't already have your My Social Security account, I really encourage you to register for that My Social Security account, add the extra security where you essentially get a security code every time you log in to plug in real time so that we can verify your identity. And at that point, you'll be in your account and you'll be able to use our calculators, check that social security statement, which is going to give you some great estimates. Our focus is disability today, and that statement is going to give you an estimate of what your disability benefit amount would be if you were to become disabled. So I had to plug that, and we're going to go ahead and get started and talk a little bit about what our program offers. All right. We know that disability can happen at any time in life. All of us probably know of a family that has a disabled child. Maybe the child was born disabled at birth, or maybe that disability occurs later in life. This can happen as an adult, as a child, and anywhere in between. So when you think about the purpose of Social Security, look at it as income that is we are replacing income that is lost due to a life event, such as a disability. Oftentimes people think of Social Security for retirement, which is true, and we do a lot of outreach and education on retirement, but disability can happen and it can really cause hardships for families. Even though it is a modest benefit, it is an important benefit to replace some of that income that is lost. We know that the numbers, it says a lot. We know as of the end of last year that we paid an average disability benefit amount of almost $1,400, which no one can live on just a disability check. It's just above the poverty level. And a lot of people are living with conditions, rare diseases, different disabilities. Around 20% of the population live with a disability, and around 18% live with a severe disability. So this is a significant program to help those in need who qualify. So on that note, I want to add this poll question. All right. True or false? Social Security pays benefits to individuals with partial disabilities. True or false? Let's test your knowledge. All right. All right. Very interesting. All right. So the answer is false. The Social Security Act sets out a strict definition of disability and pays benefits to people with a severe medical condition that prevents them from performing substantial work and is expected to last at least a year, 12 consecutive months, or it's so severe that it may result in death. Social Security does not pay benefits for a partial disability or a short-term disability. We are helping beneficiaries who are the most severely disabled. So unlike certain agencies like the Veterans Administration, for example, we don't pay a partial disability benefit. So hopefully folks learn something there. This is a program to replace income that is lost when a person becomes 100% disabled. So let's talk about the definition of disability according to Social Security. We define it as a condition or illness that is so severe it prevents a person from working at a substantial level. Okay. In addition, the condition is expected to last at least 1 year, 12 consecutive months, or it's so severe it's going to result in death. Okay, the person's medical condition must prevent them from performing substantial gainful employment. Okay, and we're talking about Social Security right now. We do have another program, the SSI program, which we'll talk about in a little bit. But when we talk about substantial gainful activity, that there is a threshold for that. And every year we have an updated amount. I'm just going to pull out my little fact sheet here just to give you an idea of what substantial gainful activity levels are. In 2024, the monthly SGA, we use a lot of acronyms, the monthly SGA amount is $1,550 for a non-blind individual. The threshold for a blind individual is a bit higher, okay? So if you are working and you have to reduce your work due to your condition and it has gotten significantly worse, that is when you want to consider, whether or not you're going to move forward with the disability application. Now, I mentioned the SSI program. Again, we use a lot of acronyms at Social Security. So I want to first start with Social Security Disability Insurance. That is the benefit that comes from the Social Security Trust Fund, and it's based on your earnings. So over time, as you're working and paying those Social Security taxes, you're building up your Social Security eligibility. I mentioned right off the bat the Social Security statement. That is your roadmap, and it's going to show you all the taxes that you've paid, all the years you've worked, and what your earnings are to date. Okay. And it's very important, to look at that statement at least once a year so you can get those benefit estimates and see, what you would qualify for if you became disabled, or later down the road if you're going to file for retirement. It also gives you estimates for the survivor benefits if God forbid you became a survivor or have a survivor in your family. Looking at supplemental security income, it's a different program, but it also pays a disability benefit to disabled children, disabled adults, and aged individuals who are 65 years of age or older who meet the income and resource requirements. For aged individuals, disability is not a part of that. So we are looking at their age and income and resources. But remember, SSI is needs-based. Okay, so those payments are coming from the General Treasury Fund, not Social Security, and SSI payments are not based on a person's earnings. Okay, SSDI is based on a person's earnings. Over time, you're building up those Social Security credits, and whereas SSI is needs-based. Okay, so looking at the side-by-side comparison, I just want to add a couple things here. With Social Security disability insurance, let's say a person became approved, they filed their disability application, they're approved for benefits. Keep in mind, SSDI has a 5 full month wait period from the date of onset. So let me give you an example. Let's say Susan became disabled January 15th, 2024. Her wait period under SSDI would begin in February. February, March, April, May, June. So her month of entitlement to SSDI benefits would be July of 2024. That's very important to know, the wait period for Social Security, whereas SSI does not have a wait period. Okay, we use different phrases, and one phrase you'll hear is protective filing date. Okay, that is the original date that we see there's an intent for you to file your application. So maybe you start your application online. Maybe you leave the application and come back to it a couple days later to finish. That initial start date is your protective filing, and that is the starting point that we're going to start looking at your application. Okay. In addition, with SSDI, there's a possibility of a 1-year retroactivity. So depending on your condition, if you're trying to give it some time and figure out if you're going to be able to go back to work or increase your work, if you've had to take some time off, you may be in this period of time where you're just figuring things out. But if you realize that you're not able to go back at that full level, that higher, substantial level, then there could be some retroactivity up to a year. Okay. Whereas with SSI, there is no retroactivity. The earliest date of entitlement would be that protective filing date. Okay. So just sharing those few tidbits, because those are questions that we oftentimes will receive. Remember, with SSDI, it is a monthly benefit for an individual who can no longer work due to that disabling condition. And remember, we do not pay a partial benefit. So if you're under your full retirement age and you've worked enough under Social Security, you may be insured. Now, younger individuals don't have to have as much work as someone that is 31 years of age or older, for example. So we do look at individuals and their age and how much they've worked in these periods of time to see if they meet those technical requirements. We call them work credits within a period of time. Now, ultimately, when we're looking at your technical criteria, we're trying to see if you have enough work and when you worked, okay? And remember, if a person is blind, they have a higher work threshold, okay? They have a higher limit. For blind individuals, that limit in 2024 is $2,590, okay? And oftentimes, folks are gonna have maybe some out-of-pocket expenses that we can also look at to see if they're over the limit. Are there income-related work expenses that we can write off? Example, a blind individual may have a seeing eye dog. They may have special devices that they have to use, special transportation needs. So in some cases, if a person is working and they're over the threshold by a bit, we're able to see, do they receive these special, do they require these special needs in order to do their job? And if so, we may be able to write some of that off. We do look at each case on a case-by-case basis. No case is the same, and I can tell you that having taken over 10,000 claims over the years, each case is very unique. And so, as I mentioned, looking at that period of time, a younger person, if they became disabled before turning 24, they're generally going to need less work. In this example, around 1.5 years of work during a 3-year period, ending with the quarter that they become disabled. Okay. For folks who are turning 24 but are younger than 31, they do require a little bit more work. And then for folks who are 31 or older, typically those individuals have to have worked the most recent 5 out of the last 10 years to meet that technical insured requirement. Okay, so this illustration is just giving you a picture of typically how much work a person has to have under the SSDI requirement. And over time, as a person ages, they're going to typically have more work, right? And one thing I want to emphasize on this slide is that, remember, once a person reaches their full retirement age, there really isn't a disability benefit. At that point, we would consider them fully retired. A common scenario for someone maybe getting disability, let's say in their 40s or 50s, if they continue to qualify, and we do periodic reviews, medical reviews and technical work reviews over the period of time. If we see that they remain disabled and they're approaching their full retirement age, once they reach full retirement age, we would categorize them as fully retired, okay, even though they'd been receiving that disability benefit maybe for several years. When should you apply for disability benefits? As soon as you become disabled. Now, everyone is trying to weigh their options. If they're working, especially, are they having to reduce their work? Are they able to go part-time? What does that look like? We tell folks, if you're trying to figure out if you're going to meet the medical criteria, to check out the Blue Book, and I'm going to refer to that a little bit later. But that really is the professional guide that provides the medical criteria needed to qualify. Okay, so whether you're a child or an adult, it's going to list the different body systems. And then within those body systems, it lists the different medical criteria, right? Having worked in the field office, I used to be asked all the time, will my claim get approved? And it's never an easy answer, because at the Social Security field office level, we are technicians. So we're helping individuals figure out all of those technicalities. We're looking at earnings, work history, if they're, what their income looks like, to see if maybe they qualify for that SSI needs-based program. So what we'll do is then send the case up for the disability review, and that goes to the Disability Determination Services. And each state has a DDS, Disability Determination Services, and they're the medical experts, the examiners, the doctors, the physicians, looking at these medical records to determine that if they meet the medical criteria. Now, processing an application can take 3 to 5 months. I'll say this, that was before COVID. I know being in Virginia, it is taking a bit longer. However, if someone had a quick disability decision, such as a terminal illness or a compassionate allowance, those cases come back rather quickly. When I used to work in the field, I have seen cases come back within 2 weeks because it's a clear-cut decision. Okay, so definitely check out the Blue Book to see what that medical criteria is and if you meet those requirements. We're going to the next poll question. True or false? The average Social Security Disability Insurance, SSDI, payment for a disabled individual is set at $500 per month. True or false? All right. Very good. Most everyone answered this correctly. 89% answered false. Very good. So the answer is false. Everyone was listening. Monthly disability payment amounts, SSDI payment amounts, are based on a person's earnings. So when you look at your Social Security statement, your earnings are going to look different than someone else's earnings. So it's very individual to your earnings. And as of December of last year, we know that The disability payments are modest and the average amount was just under $1,400 per person. Okay. On the other hand, and this is going to take us into talking about SSI or supplemental security income. On the other hand, the SSI payments are a federally set paid amount. Okay. And for 2024, that maximum monthly SSI payment amount is $943. That is set. And SSI payments can be anywhere from $1 up to that max of $943. How do you apply for benefits? Now, I mentioned online services. This is really the preferred method. It will save you time. I was just talking to someone earlier today who said, I had to go to my local Social Security office and request a replacement card. And I said, well, did you try to go online? We've really enhanced our online services to include not only filing for benefits, but other services such as a replacement card, for example. So definitely visit us online if you want to get that started. We'll be able to review it locally in our field office. Sometimes we do work sharing where other offices help out some offices. It really depends. But once we have everything we need, we're going to then hopefully send the case off for review. Now, if there's a technical issue, we may have to call you to discuss, get some clarification. And sometimes folks maybe know that they won't qualify. Maybe they're still working and earning over that threshold. They didn't make a change to their job. If they're, let's say, making $60,000, $70,000 a year, maybe they have to keep working and they're just not at that point where they fall below that threshold. So if you're wanting to get that official decision either way, whether it's approved or denied, definitely start the process online if you can. Some folks need extra help. So if you need to make an appointment, we certainly can help you with that. Our field office appointment calendars may be out. I know in Virginia, we have pretty busy field offices. So keep in mind, it may take longer to get you that appointment, but if needed, definitely give us a call and we'll help you out. Now we're going to talk about SSI, and I've alluded to this a little bit. Remember, SSI is a needs-based program. It provides a monthly benefit to people with limited income and resources, and it helps disabled children, disabled adults, and aged individuals who meet that income resource requirements. Ultimately, you have to meet these requirements, and there is a lot of reporting with SSI, okay? Because it is needs-based, we need to know if you have changes, not just medically, but technically, depending on how many people are in your home. Has anything changed with the number of family members in your home? Has the income changed? Do you have additional resources that maybe you didn't have before? So really, the same requirement in terms of the disability, you have to be 100% disabled, or we're looking at that blind test for someone that's blind, limited income, few resources, and then for folks 65 and older, disability isn't a factor, but we are looking at that income and resources. In addition, with SSI, the work rule still applies. And we're going to talk a little bit about some work incentives because we do try to help folks get back to work, but we do need them to understand what those parameters are when they're able to go back to work. So remember, with SSI, we're looking at income, resources, and where the person lives. Now, income looks different, right? We're looking at earned and unearned income. So that could include wages. If the person's receiving Social Security, maybe they have a pension. Okay, so other things such as food and shelter, what does that look like in your household? Do you have family members that are sharing food? Are you renting a room? What does that look like? And with resources, we're looking at things such as things you own, real estate, bank account, cash, stocks, and bonds. I'll just mention real quick, for SSI purposes, an individual is allowed one vehicle in their home. That is not counted against the individual for resources. But for an individual, typically the maximum, separate from their home and vehicle, the maximum they can have is $2,000. So you can see it is very much a needs-based program. We do look at income and the types of income. So these are just some examples of earned versus unearned income. Okay, so if someone is working, those would be wages. If you're self-employed, that would be you filing your taxes on a Schedule SE, scheduled self-employment form. And if you have payment for services in a sheltered workshop, just to name some examples. Unearned income could be other benefits you receive, SSA benefits, veteran benefits. Maybe the person receives unemployment. Maybe they were let go and they're trying to seek a different job. So all of these examples, interests, pensions, and cash from family and friends is looked at very closely. In terms of resources, I mentioned for an individual, the limit is $2,000. For a couple, it's $3,000. That has been set in place for a while now. But to give you just a side-by-side comparison of what's included and what's excluded, I mentioned individual is allowed their home, one vehicle, and then of course money set aside for burial. So some resources for burial, if it's allocated specifically for that, we will not count it. But anything in addition is typically counted. And this is why in the SSI application, we do ask a lot of questions. And if the application process takes, let's say, 6 or 7 months, when the claim comes back, if it was approved, we do have to revisit some of these questions because things may have changed. We know oftentimes folks are maybe transient and they're moving, and that is a reporting responsibility. Please let us know if you have one of these changes so that we can make sure if you've moved, we know how to reach you, for example. Now, with living arrangements, this is another factor that will determine how much in SSI a person can receive. And remember, the benefit may vary depending on where you live. For example, if someone is in an institution, maybe they're getting some help, maybe they have a mental condition and they're in a facility for a while. During that period of time, if they qualified for SSI, the maximum payment they could receive while in that facility is $30 a month. And oftentimes, folks are needing that health insurance, or with SSI comes Medicaid. So when a person, let's say, goes into a facility and leaves a facility, we just need to know when those changes occur so that we can adjust payment if needed. That's just to give you one example. We have another poll question. I think this will be pretty straightforward. Some examples of what to report under the SSI program include A, change in resources, B, change in residency status, C, change in school attendance, D, change in marital status, or E, all of the above. All right, everyone got this right. So we know folks are really paying attention. Thank you so much for getting that right. We are going to show you what these reporting responsibilities also include. So not only are we looking at your status changes, but keep in mind the timeliness of those changes. If you have a change to report, please do it as soon as possible and no later than 10 days after the end of the month in which the change occurred. So SSI pays benefits the month of. So for example, we are in March, and anyone that received their SSI payment earlier this month received it for the month of March. Whereas with SSDI is paid 1 month in arrears. So anyone that got an SSDI payment this month in March, that was actually February's benefit. Okay, so that's one reason why it's very important to report timely under SSI so that we can avoid any possible overpayment. Now, you can report wages online through the My Social Security account for any person that is receiving SSI. Back in the day, years ago, folks would have to either bring their pay stubs or fax those pay stubs to the Social Security field office. And now that wage reporting has been enhanced to include online and telephone options. So look at this list. It's a long list, right? And I'm not going to sugarcoat this. There is a lot to keep up with when a person receives SSI. And that's, again, to just prevent any overpayments and ensure the person is receiving the proper amount. It's not uncommon to see someone not receiving enough SSI because they forgot or didn't tell us about a change. So we always want to make sure that we're paying the person the maximum amount they're eligible for while avoiding potential overpayments. Now we're going to switch gears a little bit and just talk about SSI for children. I mentioned what disability looks like, whether it's a child or an adult. Just this morning, I was on the phone with a pediatric social worker at a hospital here in Virginia, and that hospital rep was asking about Medicare for children they help with end-stage renal disease. They have children that they provide kidney transplants to, and they were trying to understand what Medicare looked like and what SSI looked like. So we know that a lot of children face disabilities, and for children, they have to be under the age of 18 or under age 22 if they're a disabled adult child and a student regularly attending school. So depending on if it's SSDI eligibility or SSI, we do look at possible options for children. Now, with children under age 18, the child has to have a physical or mental impairment or a combination of both that it results in marked or severe limitation in function. So we know children don't have the same work history, right? They typically haven't had any work. And so we're not able to look at those earnings and see what they used to do in the past. And oftentimes we're working with schools, when they're transitioning out of high school and going into, college or the workforce, and we're looking at function. We're looking at IEPs. We want to make sure that when submitting a child application or an adult application, you don't leave anything out, right? Tell us the story. What does this look like? In addition to those medical records, what does what does the day look like for this disabled child when they wake up and when they go to bed and everything in between? Because we don't want to leave anything out. Now, in addition to the physical or mental impairment, that has to be severe disability. And with blindness, it's the same criteria for children as it is with adults. And it also has to last at least 12 consecutive months or a year. Okay. Now, the child is living with a disability, living in a household with limited income. So it's very common to see parents filing for their children, let's say SSI, and they're under 18, and they get denied for technical reasons. And oftentimes that's because Social Security is looking at the parent's income and resources while the child is under age 18. But things change once the child reaches 18. We will no longer deem or count the parent's income at that point. We would then consider them an adult, even if that now adult child is still living with the family. So, for eligibility, remember, under 18, we are going to count the family's income. Once they turn 18, we do look at things a little differently. Some examples of child income could be child support, if that child was receiving a benefit under the parent's Social Security, or gifts, just to name a few examples. I mentioned deeming, and this essentially is the process that we use to determine how much of the parent's income we're going to count, income and resources. I was just at a transition fair in Stafford, Virginia on a Saturday, talking with parents. There were about 350 families at this event, and they came by the Social Security table to ask, about this process. It's such a common question. My child was denied when they were 10 years of age because my income, me and my husband's income was counted. What will things look like at 18? And this particular example, the children had Down syndrome, and we know that is going to be an approval. So, just giving them the timeline and explaining, well, once the child turns 18, the month of age 18 attainment, you can move forward and help them with that disability application, and we will no longer count your income like we did before. Okay, this slide is just reiterating what I just shared. Remember, we're no longer going to count the income for a child that's 18, no longer count the parent's income and resources once that child turns 18. Time is of the essence. We talked a little bit about dates, timelines. So you don't want to wait too long, especially if you know that your child meets the medical criteria, right? At age 18, that's typically when a family will help get the ball rolling for that adult child application. How do you file for SSI? Well, you can begin the process online if the person meets this criteria. Now, if the person has filed previously for SSI, they are not going to be able to complete the full application online. We are enhancing our systems. We're making more, adding more to the system, giving more options. But at this time, the SSI online application is limited. So we tell folks, if you can complete the actual report online, you can start the process and then give us a call to make an appointment and finish the application. So by starting that child disability report, it's easy to do online. Here's the link, and a representative will then contact you, or you can call your local office and make that appointment to finish the application. So where are we now? We've received your application, you filed it online, or if needed, you've completed the application over the phone. What happens next? So the Social Security office is going to review all of those technical factors. And if everything is cleared, we're then going to send the case up to the State Disability Determination Services, or the DDS. Remember, they're the medical experts, and they're going to contact the medical providers to get those records. Oftentimes, we have an electronic data exchange where those records are going to come in pretty quickly. Sometimes it's more manual. It really depends on the source. So don't leave anything out. Right? In this case, when you're providing us with a picture of what disability looks like for you or your child, don't leave anything out. More is better, so to speak, right? If you're questioning whether to include a doctor, include the doctor. let us make that decision. Let us gather those records. The DDS is going to pay for those medical records. You don't have to provide them to Social Security. So include all the information. We don't want to leave anything out and make a decision. It may have been that one medical record that could have changed things. So include everything when you are filing. Now, if we don't have enough information, the DDS may reach out to you and ask for a consultative exam or schedule a consultative exam. This is common when there just aren't sufficient medical records, but keep in mind it is a scheduling matter, and so we need to make sure that we get that exam done as soon as possible, so that you can get that decision as soon as possible. Not everyone is going to need a consultative exam. Okay, I just mentioned that because sometimes it's necessary if there just aren't enough records. Now, remember the DDS, they're trained professionals, doctors, specialists, and they're going to consider all factors. They're going to look at your age, education, type of work you've done in the past, and then based on what's happening in our modern economy, are there any jobs that you could do? Even if you haven't done it before, are there jobs in our economy that you could potentially do with the condition that you have? And this is a five-step process. So we're looking at work. How severe is your condition? Does your impairment meet the listing? Let's go back to that blue book. I mentioned that resource guide. It's online on our website, and it lists the medical criteria, right? It lists those impairments. So does it meet the listing? And are you able to do the work you did before? And if not, are you able to do other types of work? So there is this five-step process that the DDS is looking at. And here we are at the Blue Book. I cannot emphasize enough how helpful this resource is. Checking to see if you meet that medical criteria, if you have that criteria to qualify. If someone asked me, will my degenerative back condition receive an approval? Again, we wouldn't be able to answer that at the local level, but check out the Blue Book to see what that requirement is. How severe does it have to be able to qualify medically? Now, remember, this can take, anywhere from 3 to 7 months, let's say, from start to finish. You want to make sure your application is full so that we don't necessarily have to do some back and forth tag and obtain more information. Now, during this process, if you have a change and you saw a new doctor, we definitely need to know that, right? So you would need to contact us and report that change. But when the DDS is ready to make that decision, they're going to send the case back to the local Social Security office, and they're also going to send you a letter letting you know whether it's approved or denied. Okay, this is very important. Read your letters and make sure that you respond timely to a request if needed. Okay, if you're approved, the letter is going to show you your approval reason and the benefit amount, when the benefits will start, and those reporting responsibilities. Okay, the field office is going to be looped into that decision and may need to recontact you, or maybe not. With SSI, we typically are going to have to do another review on the back end, whereas with SSDI, typically folks will receive the letter and will get those cases processed as soon as possible. Now, on the other hand, if the case is not approved, the letter will also explain that, and it's going to tell you how to appeal your decision if you disagree with it, right? So you've made your case, and then the DDS sends a letter explaining maybe why it's not approved. Do you agree with that? Do you disagree? You have 60 days to file an appeal if you're going to move forward. Now, what an appeal allows for is a different set of eyes to review the same information, plus any new and material information that you're providing. Okay, so this is why the communication is important, especially if you've had some changes while that initial decision is being made, right? You saw a new doctor, you maybe got some new information that you didn't have. So definitely make sure that your record is updated. And that takes us to the next poll. True or false? If a person is approved for SSI disability, they will be automatically enrolled in Medicaid through their state. True or false? Okay, we've got 34% true and 66% false. And depending on where you are, the answer is it depends. So that was kind of a catch-22 question. In most states, I had to put it in there. In most states, if you are an SSI recipient, you may be automatically eligible for Medicaid because an SSI application is also an application for Medicaid. Whereas in other states, we may not have that data exchange, and you must apply for and establish your eligibility for Medicaid with that state agency. I'm in Virginia, for example. We know that if folks qualify and get approved for SSI, they will also qualify for Medicaid, but they still need to let the Medicaid office know because it is a two-step process. All right. Remember, reporting responsibility. So hopefully none of us on this session today have any of these issues, no outstanding warrants, no convictions of crimes or violations or conditions, a condition of parole or probation. But this is important, again, because we want to prevent any overpayments. Now, remember, if you disagree with that medical decision, you do have the right to file an appeal. You can submit your appeal online, and we encourage you to do that if you disagree with it, but you've got to make that case. What's different? What do you feel has changed, or what wasn't looked at initially, if that's how you feel. Looking at that original decision and comparing it with what's happening now is going to be key. So if you disagree, you can definitely file your appeal within 60 days, and I encourage you to do that online if you're going to move forward with that appeal. Now, we want to mention some additional options that folks have been given, especially the last couple years. With COVID, we've enhanced our online services. In March of 2020, we offered this option for folks to advance designate a representative payee. You can imagine working at Social Security, we get a lot of calls from family members trying to help a parent or grandparent, for example, but our hands may be tied because we don't see that family member listed on the beneficiary's record. And oftentimes maybe you're a power of attorney, but our version of power of attorney is a little bit different. We call it representative payee. And so when you're filing your application, let's say it's your disability application online, we're going to ask you, would you like to designate in advance a representative payee if the need ever came up down the road? By saying yes and entering the individual or up to 3 individuals that you'd like to include, it is not appointing those individuals to be your payee. It's simply giving us a heads up that if you ever needed that later, we know what your wishes are, right? So this is really helpful for disabled individuals, whether adults or minors, especially with folks that maybe have mental conditions. I see adult family members trying to help parents that have dementia or Alzheimer's. And so it's very helpful to know if they need help. We're going to get a physician statement to verify they're no longer capable, and then we can make the family member the payee. Now, we've got to choose the most suitable person, right? And it typically is going to be a family member. If there isn't a family member, we do have a policy where we go through the list to see who the next best person is. Next slide. Now, I mentioned quick disability decisions. This is very important because we are going to get a decision much quicker. We expedite cases that have compassionate allowances. So many cancers, I think we have over 280 compassionate allowances listed. If you visit this link at the bottom, it will tell you what those specific conditions are. And it allows us to identify these cases very quickly and approve them very quickly. This is important partially because of what I mentioned earlier about that 5 full month wait period under SSDI, or if SSI is also involved, we're going to be able to get that individual into payment pretty quickly under SSI. So something to think about if you're helping someone or know someone with a compassionate condition, compassionate allowance. We also have a provision for our wounded warriors. If you have 100% permanent and total disability rating with the Veterans Administration, we are going to be able to expedite that application. It doesn't guarantee an approval because our rules are different than the VA's, but it allows us to see that the person has 100% VA rating. So we're going to make that decision pretty quickly. Okay. And that also is for individuals filing for SSDI and SSI. So definitely check out the Veterans section of our website for more information. On that note, we have another poll. True or false? Many people receive both SSI and Social Security benefits and can receive both Medicare and Medicaid. True or false? All right, 52% answered true and 48% answered false. It's pretty split there. So the answer here is true. So Medicaid is linked to a person's SSI benefits in most states, whereas Medicare is our country's health insurance program, and that is linked to the entitlement of Social Security benefits. It is possible for an individual to receive both Medicare and Medicaid because the states do pay the Medicare premiums for individuals who receive SSI, that needs-based program, right? That needs-based benefit, if they're also eligible for Medicaid. So if you get SSI and have Medicare, you'll also be eligible for extra help with Medicare prescription drug plan costs without having to file a separate application for that Part D extra help. On that note, I just want to mention the extra help option for individuals who are needing some help with their prescription drug plan costs. So this could include help with that premium, copays, deductibles. It's valued up to about $5,900 a year if the individual meets the income and resource requirements. And folks can actually apply online through the Social Security website, or as I mentioned, if they qualify for SSI and SSDI, then that could be an automatic application. This is common as well for individuals who are 65 and older. Maybe they receive a little bit an aged SSI benefits and a little bit of Social Security, and they have both Medicare and Medicaid. The state can come in and help maybe pay those prescription drug plan costs. But remember, an application is needed if they're not receiving SSI. We have a lot of updates year to year, and those updates typically take place in January of each new year. We also have a fact sheet on our website, and I know that SSDI Health will be providing some additional resource links after this session. But just in a nutshell, we want folks to know, the new numbers for 2024. With SGA, substantial gainful activity, the amount for a person with a disability who is not blind, that monthly earnings limit is $1,550 per month. Whereas someone who is blind does have that higher limit of around $2,590 per month. I mentioned working just a little bit, but keep in mind, let's say you're approved for disability and some time passes and now you're trying to test your ability to return to work. We do have some work incentives and trying to help folks get back into the workforce where they get a trial work period. And then there's these different periods where they can test their ability to work, but then eventually they're going to need to make sure that they're within those parameters, within the limit. So a trial work period is essentially a 9-month period when a person first tries to go back to work and they're testing their ability, and that amount, it's a set amount each month, and to reach a trial work period month this year in 2024, that monthly limit is $1,110. So $1,110 a month. If you're trying to get back to work, you get 9 of those, and then we go into the next period, which is essentially staying under the regular limit. With SSI, remember, it is a federally set amount. And so the federal benefit rate per person this year, per person per month, is $943 for SSI. And then that's for an individual. And then for a couple, it is $1,415. All right, I almost skipped this slide. I just want to mention also, let's say you have a disabled adult child or a child that's just turned 18, they've graduated high school, they have a disability, and they're also trying to work. Keep in mind that SSI beneficiaries are also able to test their ability to work, and we're not going to count all of their earnings. So for students who are under age 22, they do have a cap of earnings, $9,230 a year. So again, we're going to work with the individual, to try to help them get back into the workforce. If they're unsuccessful, we will look at that as well so that it doesn't penalize them. But if they're able to maintain that over time and increase their work, eventually they may no longer qualify for the benefit. In addition to limits for benefits and earnings limits, we also look at Medicare. The Medicare premiums can change a little bit year to year. Social Security helps people enroll in original Medicare, and those are A, hospital insurance, and then Part B, medical insurance. And the Part A is basically room and board if you have to spend the night in the hospital, okay? Whereas the Part B is what most people need on a regular basis. That's anything the doctor's involved in, medical doctor's visits, procedures, and so on. So For someone who has less than the necessary credits, let's say for Part A, they have less than 30 credits, they're going to have to pay for Part A out of pocket, and that's about $505 a month. Whereas the Part B standard premium per person per month, this is what most people pay, is $174.70 per person per month. Now, if folks have higher income, they're going to pay more for their Medicare Part B and prescription Part D. But most folks are paying the standard rate, and if you're getting benefits, that monthly Medicare premium will come out of your Social Security. If you're not receiving benefits and qualify for Medicare, you would have to pay Medicare directly. Now, we talked about the blue book. I just want to mention the red book. Back in the day, we used to have these physical books, blue books and red books, and now everything's online. They're pretty detailed, and the red book is very helpful post-entitlement. So if you get approved for benefits, you're trying to go back to work, this is your employment support. It's giving you some information on the rules, the process, like how to stay within the parameters of working while disabled, right? And again, it's helping you as the beneficiary, if you qualify, get your feet wet, right? Try to get back to work. Are you working with your rehabilitation groups? Are you working with the state to try to find a job that can assist you while managing your disability? So definitely check out this section, the Red Book section of our website. We talked a little bit earlier about how to apply for benefits. I can't emphasize enough, the online option is going to be the fastest, easiest way for you to complete an application if you can use online services. It's going to save a lot of time. So online if you can, or if needed, schedule an appointment. I never tell someone just walk into your office because I can't guarantee that there'll be someone to actually complete the application right then and there. So if needed and you want that telephone appointment or in person, make sure you call to make that appointment. We want to note that children applications and survivor applications cannot be done online at this time. So, you will need to make that appointment. And for children, you can do a little bit online, but you will have to finish the process through an appointment. This is what our website looks like. If you go to socialsecurity.gov or ssa.gov, make sure you're at the right place. There are so many scammers out there, unfortunately, and they're trying to spoof, Social Security and other federal agencies. Just protect your information. Make sure you're using a safe, secure computer, and add that extra level of security when you are conducting business with us. I mentioned the My Social Security account. This is really where you can access your personal information. I think right now we have 11 calculators where you can do some, month of election comparison, especially for folks that are thinking about retirement. With disability, those figures are pretty set based on your earnings up to date. And then of course the SSI benefits are a federally set amount. So looking at that Social Security statement is so helpful. You want to make sure those numbers are accurate. Every year you're filing your taxes and IRS sends us your earnings. So make sure you're checking it once a year to ensure that those earnings posted are accurate. And I'm almost done here. I'm going to just plug our social media. We do have a really great social media presence: Facebook, Twitter. We have YouTube, LinkedIn, and then for anybody looking for a job with Social Security, we should have some job postings on our LinkedIn page as well. But all joking aside, I just personally hope that you found this information helpful. I know Amy's going to come on here and talk a little bit about how SSI Health helps mutual clients.
Thank you again for joining us today. As I mentioned, I'm Amy Jackson, Case Management Specialist with SSI Health, and want to talk a little bit about our case management program. I'll also share with you about our Access program and how it is connected to our presentation topic today regarding Social Security benefits. So what is case management at SSI Health? Well, health insurance education is the focus of what we do, but advocacy is at the heart of everything that we do. Our program is designed to help our patients understand their coverage options, and that can include contacting Social Security regarding their benefits and eligibility for Medicare. We assist our patients by completing benefit investigations to ensure proper billing, understand enrollment periods, coverage benefits and restrictions, information on coverage appeals, understanding savings and eligibility, and locating resources. So it encompasses a lot, but our goal is to connect our patients with the care they need. So why does case management matter? What are the benefits of a case management program? Well, I wanted to just highlight a few. So when individuals have insurance available to them, they often have options for coverage. We help our patients identify all of the options available to them so that they're making the best decision for their self and their coverage needs. When our patients are billed for services, errors can occur. Errors can occur when processing of claims such as human error or technical error. We help our patients identify when those errors occur and how to correct them. Also, when you are trying to enroll in health insurance or make changes to your current health insurance, you generally can't do that whenever you want to. So we help our patients identify the enrollment periods they may be eligible for so they can obtain or change coverage when they need to. Also, when our patients have health insurance, there's often limitations and restrictions to the coverage. So we often see that with specialty medications, whether it be a prior authorization or a quantity limit or step therapy needed to get the medication covered. We help our patients identify those things so that they do not have, so they'll be prepared and there's no lapse in getting the treatment or care that they need. When a covered service is denied or your health insurance is canceled altogether, we can help you identify those reasons and decisions and direct you in the right place should you disagree with those decisions. Most decisions you can appeal, and again, we help you identify or understand some of the terms involved in the decision, and then if you choose or disagree with the decision that was made, then we help you locate resources to appeal those decisions. When insured, our patients often have savings available to them, and we help identify the savings programs they may be eligible for and how to apply. And when your benefits are unaffordable, we help you identify and locate resources, whether that be national or local programs like Accessia Health. To be eligible for case management at Accessia Health, you must have a diagnosis within an Accessia Health patient program. However, for those of you calling for assistance and don't qualify for one of our programs, we will do our best to locate resources to assist you with navigating your coverage. We also have educational resources available online, such as videos and webinars. So I mentioned I wanted to share with you about our Access program. We didn't talk about this during the presentation, but we have a wonderful resource available to our patients that meet the criteria. Our Access program actually stands for Advocating for Chronic Conditions, Entitlements, and Social Services. It is a free disability legal aid program offered by Accessia Health for families that are facing chronic medical conditions. So as I mentioned, you have to have a diagnosis in this program that's listed on your screen. You'll see those diagnoses listed there, but this program provides nationwide help with disability legal aids, SSDI claims, and SSI claims. And as you'll see from the little stat on the right side of your screen, we have a 76 approval rate with SSDI claims. So we hope to expand this program, so definitely check us out. Again, contact us by phone, online, or by sending an email to casemanagement@accessiahealth.org. Again, thank you all for joining us today, and follow us on social media at Accessia Health to learn more about upcoming webinars. Thank you.